Coming to the external anatomy of the nose, the upper third of the nose is supported by bone. The lower two-thirds is by cartilage. Air enters the nasal cavity through the anterior nares on either side and then passes into the widened area known as vestibule. Gently press on each ala nasae and ask the patient to breathe in. Tilt the patient's head back a bit and insert the speculum gently into the vestibule of each nostril. Avoid contact with the sensitive nasal septum by directing the speculum posteriorly then upward in small steps. Try to see the inferior and middle turbinates, the nasal septum, and the narrow nasal passage between them. Note its color, any swelling, bleeding, or any exudate. Generally, the nasal mucosa is more red in color. The lips are the muscular folds that surround the entrance of the mouth. When open, the gums and the teeth are visible. The gingiva is firmly attached to the teeth and to the maxilla and mandible in which they are seated. In lighter skinned people, it's pale pink or coral pink, and in dark skinned people, it's patly brown. A midline mucosal fold called the labial frenulum connects each lip to the gingiva. Adjacent to the gingiva is the alveolar mucosa, which emerges with the labial mucosa of the lip. Each tooth composed chiefly of dentin, which lies rooted in a bony socket with only its enamel covered and crown exposed. The small blood vessels and nerves enter the tooth through its apex and pass into the pulp canal and the pulp chamber. The dorsum of the tongue is covered with papillae, giving it a rough surface. Some of these papillae look like red dots which contrast with the thin white coat that often covers the tongue. The undersurface of the tongue has no papillae. The middle lingual frenulum connects the tongue to the floor of the mouth and the ducts of the submandibular gland. The paid sublingual salivary glands lie just under the floor of the mouth mucosa. Behind the tongue rises an arch formed by the anterior and posterior pillars, the soft palate, and the vulva. The posterior pharynx is visible in the rhexis behind the soft palate and tongue. The buccal mucosa lines the cheeks. Each parotid duct opens into the buccal mucosa near the upper second molar. If the patient wears any dentures or lipstick, offer them a paper and ask the patient to remove them so that you can inspect the underlying mucosa. Observe the color of the lips, its moisture. Note any lumps, ulcers, or cracking or scaliness. Look into the patient's mouth and with a good light and with the help of a tongue blade, inspect the oral mucosa for color, ulcers, white patches, and nodules. Note the color of the gums, which are normally pink. Inspect the gum margins and the interdental papillae for swelling or ulceration. Inspect the teeth. Are any of them missing, discolored, misshapen, or abnormally positioned? Inspect the color and architecture of the hard palate. Ask the patient to put out their tongue. Inspect for its symmetry, its color, and texture of the dorsum of the tongue. Wearing a gloves, palpate any lesions. With your right hand, grasp the tip of the tongue and gently pull it to the patient's left. Inspect the side of the tongue. Repeat the same process on the other side. With the patient's mouth open but the tongue not protruded, ask the patient to say "ah." You can press the tongue blade firmly down on the midpoint of the arched tongue. Simultaneously ask for another ah. Notice the rise of the soft palate. Now inspect the soft palate, anterior and posterior pillars, vulva, tonsils, and the pharynx. Note the color, symmetry, and look for any exudate swelling, ulceration, or tonsillar enlargement. Palpate the lymph nodes using the pads of your index and middle finger. Press gently, moving the skin over the underlying tissues in each area. The patient should be relaxed with the neck flexed slightly forward, and if needed, turn slightly toward the side being examined. You can usually examine both sides at once, noting both the presence of lymph nodes as well as asymmetry. For the submental node, however, it is helpful to feel with one hand while bracing the top of the head with the other. Ask the patient to sip some water and to extend the neck and swallow. Watch for upward movement of the thyroid gland. The thyroid cartilage, the cricoid cartilage, and the thyroid gland all rise with swallowing and then fall to their resting positions. Confirm your visual observations by palpating the thyroid gland, cricoid cartilage, and the thyroid cartilage.